Premature ejaculation, PE, is a common sexual dysfunction characterized by a lack of control over ejaculation, occurring sooner than desired during sexual activity. This condition affects both the affected individuals and their partners and can lead to psychological and emotional challenges. Understanding the signs and symptoms of PE is essential for diagnosing and managing it effectively. Here's a comprehensive look at the symptoms of PE, focusing on primary and secondary indicators, psychological impact, physical sensations, and patterns of occurrence. 1. Definition and overview. Premature ejaculation is generally defined as an inability to delay ejaculation for a sufficient amount of time during sexual activity. Although specific timing varies for each individual, ejaculation usually occurs within a minute of penetration in those with severe PE. This condition can be divided into two main types: lifelong, primary PE, present since the individual first became sexually active; acquired, secondary PE, develops later in life, often due to psychological or physiological factors. The International Society for Sexual Medicine, ISSM, defines PE as ejaculation that always or nearly always occurs within about 1 minute of vaginal penetration in lifelong cases or a short time in acquired cases. The inability to delay ejaculation consistently. Negative personal consequences, such as distress, frustration, and avoidance of intimacy. 2. Key signs and symptoms of premature ejaculation. A. Rapid ejaculation. The hallmark symptom of PE is the occurrence of ejaculation sooner than desired, often within a minute of penetration. In some cases, ejaculation may happen even before any sexual contact, i.e., during foreplay or other intimate moments. The inability to control the timing of ejaculation is often the primary sign of PE and may vary in severity from one individual to another. B. Lack of control over ejaculation. A characteristic sign of PE is a consistent lack of control over the timing of ejaculation. Individuals with PE may feel unable to control or delay ejaculation, despite their attempts to do so. This lack of control differentiates PE from occasional premature ejaculation episodes that can happen to anyone under certain circumstances. C. Distress and frustration. PE often causes significant distress, frustration, and anxiety in affected individuals. The inability to enjoy prolonged sexual activity or satisfy one's partner can lead to feelings of inadequacy and disappointment. This emotional response is a crucial symptom that, in many cases, prompts individuals to seek help for PE. D. Reduced sexual satisfaction. Because PE typically limits the duration of sexual activity, it often leads to reduced sexual satisfaction for both the individual and their partner. The affected person may feel dissatisfied with their sexual performance, leading to decreased interest in future sexual encounters and potentially harming the relationship. Avoidance of sexual intimacy. The distress and frustration associated with PE can lead some individuals to avoid sexual intimacy altogether. They may fear failure, embarrassment, or dissatisfaction, which can create a cycle of avoidance and worsening symptoms. This avoidance can significantly impact relationships and reduce the quality of life. F. Psychological and emotional symptoms. PE is often accompanied by psychological symptoms, including anxiety. Anxiety about one's sexual performance is common among those with PE, and it can exacerbate the condition, creating a cycle of anxiety and rapid ejaculation. Depression. The persistent dissatisfaction and frustration stemming from PE can lead to depressive symptoms. Low self-esteem. Chronic issues with PE can harm self-esteem, as affected individuals may feel they are not meeting their partner's expectations or their own. G. Physical sensations associated with premature ejaculation. Some individuals with PE experience physical sensations leading up to ejaculation that they cannot control. These may include an intense, often sudden, buildup of tension and arousal that leads to ejaculation before the individual is ready. A lack of ability to hold back the ejaculation reflex, even when consciously attempting to do so. These sensations are often quick, intense, and difficult to manage, leaving the individual unable to delay ejaculation. H. Impact on relationship satisfaction. PE can lead to tension within relationships due to dissatisfaction with sexual activity. Partners may feel unfulfilled or misunderstood, while the individual with PE may feel pressure and guilt. These relational strains can sometimes worsen the psychological impact of PE, reinforcing feelings of inadequacy and distress. 3. Psychological and behavioral patterns. A. Anticipatory anxiety. One common behavioral pattern is anticipatory anxiety, where the individual feels anxious before engaging in sexual activity, fearing that they will ejaculate prematurely. This anxiety can create a self-fulfilling cycle where the fear of PE leads to increased likelihood of PE occurring. B. Performance anxiety. Performance anxiety is often related to PE. The pressure to perform and satisfy one's partner can contribute to rapid ejaculation, as the individual is overly focused on not ejaculating too soon. Ironically, this focus on control may have the opposite effect, leading to quicker ejaculation. C. Patterns of sexual avoidance. Some individuals with PE may begin to avoid sexual situations to prevent the feelings of embarrassment, disappointment, and frustration associated with rapid ejaculation. This avoidance can impact overall relationship satisfaction and intimacy, contributing to further psychological distress. 4. Types and timing of premature ejaculation. A. Situational versus generalized PE. Situational PE occurs only in certain situations or with specific partners. For example, some individuals may only experience PE with new partners or in stressful conditions, suggesting psychological factors at play. Generalized PE happens consistently across all situations and partners. This type is often related to lifelong or chronic PE and may require different management approaches than situational PE. Immediate versus delayed onset. Immediate onset. Ejaculation occurs almost immediately upon sexual stimulation or penetration. This type of PE is usually associated with lifelong cases. Delayed onset. Ejaculation happens after a short duration, though still sooner than desired. This may be seen in acquired PE cases or in those where psychological stress influences the timing of ejaculation. C. Primary versus secondary PE. Primary PE, present from the beginning of an individual's sexual experience, typically with no other health issues contributing to its cause. Secondary PE develops later in life, often due to factors such as stress, relationship changes, medical conditions, or side effects of medications. 5. Complications associated with premature ejaculation. PE can have several consequences beyond the sexual symptoms themselves. The primary complications include relationship strain. PE can create tension, frustration, and even resentment between partners. Open communication and shared understanding are essential to maintaining a healthy relationship. Reduced quality of life. The impact of PE on emotional health can reduce overall quality of life. Individuals with PE may experience reduced social engagement, lowered self-confidence, and less interest in activities that involve potential romantic or sexual encounters. Sexual dysfunction. Over time, PE may lead to other sexual dysfunctions, such as erectile dysfunction, due to the ongoing psychological stress and performance anxiety associated with the condition. 6. Diagnosis and evaluation of PE symptoms. Recognizing the signs and symptoms of PE is critical for accurate diagnosis. Healthcare providers typically evaluate PE using a comprehensive approach, which may include medical and sexual history. Understanding an individual's medical and sexual background helps identify potential contributing factors. Questionnaires and assessment tools. Tools like the Premature Ejaculation Diagnostic Tool, PET, are often used to measure the frequency, intensity, and impact of PE symptoms. Physical examination and laboratory tests. While rare, certain medical conditions like hormonal imbalances or prostate issues may contribute to PE. Tests may be conducted to rule out these underlying issues. Conclusion. Premature ejaculation is a complex condition involving both physiological and psychological symptoms. Recognizing the signs and symptoms of PE is essential for accurate diagnosis and effective management. With the right treatment and support, individuals can manage PE, improve sexual satisfaction, and enhance overall quality of life.